The screening actually has a twofold purpose. Primary purpose is to find out if I can help you. The second is for you to meet me and see if you like me and like my office and if what I do makes sense to you. The screening is important because we don't often know if we've injured the spine or how bad it is. And so we want to check those things and see, even if the symptoms aren't very bad or if you have no symptoms whatsoever, so that we don't find out in 30 years that now you have a heart problem because a nerve that's coming from your spine that's going to your heart isn't working as well as it should. I actually recommend people, whether they have problems or not, get screened about every 6 months. When we find a problem, then we'll deal with it, and hopefully we never do. But the screening is something that will help us find a problem, hopefully years before you actually feel the problem. So in the screening, there's several components. The first is just you and me talking about what the issues are, what brought you to my office. The second is the testing phase where we determine whether it's something I can help you with or not. And that is divided up into a neurological component and a measurement component. The neurological component has two tests. The first one is just measuring the temperature of your skin on either side of the spine, just in the neck region. It gives me some information about the nervous system and how it's functioning. The second is having you lay on your stomach or on your back and looking at the length of your legs, which may sound kind of strange, but leg length can give us some really good information. Now, it may just be that you were born that way with legs a little bit crooked, or you injured something, it never healed up quite right. Or it could indicate that there's a problem in your spine that your body is compensating for, and it changes the tension of the muscles all the way down the spine, causes the pelvis to twist a little bit. If the pelvis twists a little bit, then the hips are not going to be level. If the hips aren't level, one leg is going to look and act like it's shorter than another one, and then that can cause other problems. So we look at that, and then we run some tests from there to determine what is causing that short leg. Is it a neurological problem in the spine? And if so, where in the spine is it? Which bone? And it'll even sometimes give us some indication of how it's moved and what I need to do to correct it. After we do those two tests, then we do a posture measurement. Now, posture also is very different from person to person, and there can be about 3 different factors that can determine how you're standing and what's correct for you. When I do the posture analysis, one component is a study of weight distribution on bilateral scales. That means I have you get up on 2 different scales and I see if you're putting more weight on one foot or the other. Now, normally we should be about the same, maybe 1 pound different. But I've had people come in regularly 12, 13, 14, even 20 or 40 pounds different, heavier on one side. Now, do you think that's going to cause a problem? Their symptoms might just be because they're putting more weight on one side because of a spinal problem somewhere where they have no pain. But now they're getting knee pain, ankle pain, hip pain, low back pain because their posture is so distorted and they're putting a lot more weight over on one side. Then we'll sit down and we'll talk about the findings. And we'll say, okay, I can help you. You don't have a problem. You're doing fine, especially if it's just a checkup, you don't have any symptoms. If you have symptoms and it's not a spinal issue, we'll talk about what the different options are for you, where you can go to get that fixed. If I'm not finding anything, you're healthy, I would probably recommend another checkup in 6 months to a year just to make sure you're still doing well. But if I do find something, at that point we'll go over what the process is. What's the next step? What do we need to do to fix this? How long is this going to take? How much will it cost as far as we can tell at this time? I recommend that screening starts at birth and then proceeds throughout life. It doesn't mean you have to see the chiropractor a lot, but we want to make sure that especially as a child grows, that they're growing straight. But even as we're an adult and we're involved in sports and we get into car accidents, that it doesn't cause permanent damage that you may not really realize until 20 or 30 years after the fact.